Hello, everyone, and welcome back to the Beyond Reality podcast, where we explore the cutting edge of virtual and augmented reality technologies and how they're transforming our world. I'm your host, Brianna Hodge, and today we have a truly fascinating episode lined up for you. We'll be diving deep into the realm of healthcare innovation, specifically how virtual reality is being leveraged to alleviate chronic pain. Joining me today is one of our resident experts and a new co-host for the podcast, Claire Ashbourne. Claire, how are you today?
Hey, I'm doing great. I'm really excited about today's topic. It's incredible to see how VR is not just for gaming or entertainment anymore, but is making significant strides in healthcare, especially in pain management.
Absolutely, Claire. The intersection of technology and healthcare is one of the most promising frontiers today. So to kick things off, could you give us an overview of how virtual reality is being used to alleviate chronic pain?
Of course, virtual reality has emerged as a powerful tool in pain management by essentially tricking the brain into focusing on immersive virtual environments rather than the pain signals it's receiving. This is based on the concept of distraction therapy. For chronic pain sufferers, their nervous system is often in a heightened state of sensitivity. By engaging them in a fully immersive VR experience, we can help reduce their perception of pain. Moreover, VR can be tailored to include therapeutic exercises, mindfulness meditation, and even cognitive behavioral therapy techniques. All of these can contribute to not just distracting from pain, but also addressing some of the underlying psychological components that exacerbate chronic pain conditions.
It sounds like virtual reality is creating this multisensory experience that is capable of rerouting how people experience pain. It's so interesting to think about how VR isn't just acting as a passive distraction, but is actively engaging multiple areas of the brain in a way that traditional methods simply can't. I'm reminded of a study I came across a while back that looked at how burn patients were able to manage their pain more effectively by using VR during dressing changes. You can imagine the kind of intense pain these patients endure daily, and yet by immersing them in a carefully crafted virtual environment, they reported a significant decrease in pain, almost as if their brains were so captivated by this alternate reality that it had to turn down the perception of pain in their bodies. I find it mind-blowing, really. Could you share some real-life case studies or examples that really showcase the effectiveness of VR in chronic pain management? I think hearing about specific instances will give our listeners a clearer picture of how transformative this technology can be.
Absolutely, Bree. One well-documented case is a study conducted at the University of Washington. Researchers there developed a VR game called Snow World, specifically designed for burn patients. It places patients in a calming, snow-covered environment where they can playfully throw snowballs at penguins or explore icy canyons. For patients undergoing painful wound care, this VR experience provided substantial relief. Many reported up to a 50% reduction in their pain compared to those who did not use VR. Snow World really shows the potential of VR in acute pain settings. Another impactful example is the work of Dr. Brennan Spiegel at Cedars-Sinai Medical Center. His team explored how VR could benefit hospitalized patients dealing with a range of chronic pain conditions. One group of patients used VR for guided relaxation, while the control group watched wellness videos. The results were profound. The VR group experienced significant pain reduction, with some reporting relief lasting up to 48 hours after a single session. The feedback showed that patients felt more in control of their pain and appreciated the non-invasive nature of VR therapy. Then there's the case of chronic lower back pain patients who participated in VR-based physical therapy exercises. By using VR to make the exercises more engaging and visually stimulating, patients adhered more consistently to their therapy plans. This had a positive impact on both their physical recovery and their pain levels.
Hearing about patients' real experiences, especially those facing the kind of unrelenting pain that burn victims or chronic pain sufferers deal with daily, it really puts into perspective just how impactful this technology can be. And I love that you mentioned patient adherence to treatment. It's something that doesn't always come to mind initially, but it's so critical, isn't it? Often, these patients are prescribed physical therapy exercises, but they struggle to stay motivated because the exercises can feel repetitive or don't seem to provide immediate relief. VR, by making these exercises more interactive and enjoyable, encourages patients to stick with their programs, which is such an important piece of their healing journey. I'm curious, though, about what's actually happening on a neurological level here. How is it that immersing someone in a virtual environment can have such a significant impact on pain perception? Is it purely distraction, or is there more to it?
That's a great question, Bree, and you're right. There's definitely more at play than just distraction. While distraction is a primary component, VR's impact on pain perception is rooted in more complex brain processes. For one, VR is a multisensory experience. and engaging multiple senses requires significant cognitive resources. Our brains have a finite capacity for processing information, so when immersed in VR, especially in an engaging or novel experience, the brain allocates fewer resources to processing pain signals. Then there's neuroplasticity to consider, the brain's ability to form and reorganize connections. In chronic pain sufferers, the brain sometimes develops maladaptive pathways that make pain feel more intense. VR can help rewire these pathways by providing new stimuli and experiences that encourage the brain to create more adaptive responses. Lastly, VR can help patients achieve a state of relaxation, which reduces stress and anxiety, two factors that exacerbate pain. For instance, VR experiences that include guided meditation or calming virtual landscapes can help patients release muscle tension, which in turn reduces pain.
It's as if VR is tackling pain on multiple fronts: distraction, cognitive engagement, and even relaxation, which all contribute to a reduced pain experience. And when you mention neuroplasticity, it really underscores how this technology has the potential for longer-lasting effects, doesn't it? It's not just offering a temporary escape from pain, it's actually training the brain to respond differently to pain stimuli over time. That's such a promising development. I'm also interested in how VR could help with something like phantom limb pain, which is notoriously difficult to treat. From what I understand, there's been success with mirror therapy in these cases, and VR seems like it would be an ideal medium to take that concept even further. Have there been studies or case examples that explore this application?
Yes, VR has indeed shown promise in treating phantom limb pain, which is often challenging to manage through traditional means. Mirror therapy, as you mentioned, involves using a mirror to create the illusion of movement in the missing limb, which can alleviate some of the pain sensations. VR can take this a step further by creating a digital representation of the missing limb that patients can interact with in a virtual environment. One impactful study conducted in Sweden used VR to provide amputees with a virtual limb they could see and control using electromyography signals from their residual muscles. The patients could perform activities like picking up objects or doing simple exercises with their virtual limb, and many of them reported significant reductions in phantom limb pain after several VR sessions. One patient in particular had suffered from phantom pain for nearly 5 decades, and after just a dozen VR sessions, he experienced a dramatic decrease in his pain levels, something he hadn't achieved with any other therapy. This really showcases VR's potential not just to distract from pain, but to help the brain reframe its pain perception.
Hearing about a patient finding relief after decades of suffering is honestly moving. It really highlights the life-changing potential of VR in healthcare, especially for those who feel they've exhausted all other options. And what stands out to me is that VR isn't merely a band-aid for the pain, but has the ability to help patients rewire how their brain experiences it. It's almost as if VR is enabling them to gain back a sense of control, which is so important for anyone dealing with chronic pain or phantom sensations. Now, personalization seems like a critical element here. Every patient has unique pain triggers and tolerances, and I imagine the effectiveness of VR therapy increases when it's tailored to each individual. How customizable are these VR therapies, and what factors are considered when they're being designed?
Personalization is absolutely essential to making VR therapy as effective as possible. A one-size-fits-all approach doesn't work for pain management because, as you mentioned, each patient's experience of pain is unique. When designing VR therapies, clinicians and developers look at factors like the type of pain, its location, the patient's mobility level, and even their psychological state. By tailoring the experience to the individual, VR can address their specific needs more directly. For example, someone with chronic back pain might benefit from VR experiences that simulate gentle movements, like walking through a tranquil forest, to encourage subtle physical activity without triggering their pain. Meanwhile, pediatric patients, who often respond well to playful environments, might engage with VR games that incorporate therapeutic movements or guided relaxation techniques in a more interactive way. Additionally, biofeedback can be integrated into VR to provide real-time responses. So if a patient's heart rate or muscle tension increases, the VR environment can respond by shifting to a more calming scene or prompting relaxation exercises, making the experience even more personalized and effective.
It really emphasizes how adaptable VR technology is in meeting each patient where they're at in terms of their unique needs and experiences. And I can see how having biofeedback directly connected to the VR environment would create a powerful feedback loop, where the therapy isn't just responsive, but is almost symbiotic with the patient's physiological state. That kind of real-time adaptability must be incredibly reassuring for patients, especially those who may feel frustrated by treatments that don't fully address their pain. It sounds like this level of customization requires a collaborative effort among healthcare providers, neuroscientists, software developers, and even designers. Could you elaborate on the interdisciplinary nature of creating VR therapies and how these different fields come together?
Absolutely. Developing effective VR therapies is very much an interdisciplinary effort. It requires healthcare providers who understand the patient's clinical needs, neuroscientists who grasp the underlying brain mechanisms, software developers who can translate those needs into a functioning VR experience, and designers who make the experience as immersive and accessible as possible. For instance, medical professionals provide critical insights into what the patient needs in terms of therapy, goals, and physical limitations. Neuroscientists and psychologists can weigh in on the cognitive and neurological factors that will make the VR experience beneficial. Developers then bring these ideas to life by creating a seamless, user-friendly VR environment, ensuring it's engaging without being overwhelming. An excellent example of this interdisciplinary collaboration is the company Applied VR. They've partnered with research institutions and hospitals to develop and test VR programs specifically designed for pain management, resulting in clinically validated and effective content. It's inspiring to see how different fields can come together to create something that genuinely transforms patient care.
Collaboration really seems to be at the heart of advancing VR in healthcare. Each discipline adds a piece to the puzzle, creating a holistic experience that's far more than the sum of its parts. Before we wrap up, Lyra, for those listening who might be interested in exploring VR for pain management themselves or for a loved one, do you have any practical advice on how they might get started?
Of course, Bree. If you're interested in exploring VR for pain management, the first step is to consult with your healthcare provider to see if it's appropriate for your condition. Consulting a healthcare provider is important because they can assess whether VR therapy is suitable for your specific type of pain and may be able to connect you with professionals or clinics that offer VR as part of their treatment options. Pain management clinics, rehabilitation centers, and some hospitals are beginning to integrate VR, so it's worth inquiring within your local healthcare network. There are also consumer-level VR applications designed for relaxation, meditation, and even light movement exercises that can be accessed using mainstream VR headsets. These apps might not be as personalized as clinical VR, but they can still provide significant benefits, especially for reducing stress and promoting relaxation. However, it's essential to treat these as complementary to, rather than a replacement for, traditional medical treatments. Staying informed is key too. There's a lot of promising research coming out, so keeping an eye on recent studies or joining patient forums where people share their VR experiences can be very helpful. The field is advancing quickly, and as we see more validation from large-scale clinical studies, I think VR will become a more recognized tool in the pain management landscape.
That's excellent advice, Claire. Consulting with a healthcare provider, exploring consumer apps, and staying informed about ongoing research all sound like practical steps that can help people approach VR with a sense of readiness and intention. And I love that you highlighted how VR should be complementary to other treatments. It's such an important reminder that, while VR is a powerful tool, it's part of a larger, multifaceted approach to managing pain effectively. I also think that your suggestion to explore patient forums is great. Hearing directly from others who have tried VR for pain management can provide that peer perspective and maybe even offer insights into what worked well for others in similar situations. And you're right, this is an evolving field, and the technology itself, as well as our understanding of it, is advancing at an impressive pace. Cleo, thank you so much for guiding us through this incredibly insightful discussion. We've explored the mechanisms, the science, and the real-life impacts of VR in alleviating chronic pain, and I feel like we've barely scratched the surface of this technology's potential. I'm inspired by the stories and the research you shared, and I think our listeners will be too.
Thank you, Bree. I've really enjoyed this conversation, and I'm hopeful that the insights we shared today might encourage listeners to look into VR as a viable option for pain management, either for themselves or someone they care about. It's a transformative field, and I think the future holds even more exciting developments that will bring relief to so many who are dealing with chronic pain.
Well said, Claire. And to our listeners, thank you for joining us on this journey into the possibilities of virtual reality and pain management. If you enjoyed this episode and have questions, suggestions, or a personal story to share, feel free to reach out to us. Your insights help shape our future discussions, and we'd love to hear from you. This is Brianna Hodge, and on behalf of myself and my co-host Claire Ashbourne, thank you for tuning in to the Beyond Reality podcast. Stay curious, stay open to innovation, and remember that the future of healthcare is as bright and expansive as we can imagine it to be.